Okay, we're going to go back to these notes to finish up. So when we finished the other day, we were on sagittal. So the sagittal is the median plane. So going down the middle, remember the median of the road. So this is dividing that body into left and right portions. And from your directional terms poster, a lot of you guys learned this as well. So that mid sagittal and sagittal are basically the same thing, or are the same thing, passing through that midline. Parasagittal would be one that is not in the midline. So but it was still this cut, this red cut here, but maybe off to the left or right a little bit. Frontal plane here divides the body into that anterior and posterior sections. This is also called the coronal plane. Transverse or horizontal is going to divide the body into superior and inferior portions. And obviously, that would be a horizontal cut there. Okay, so regions of the brain. You're probably going to have to pause the PowerPoint so that you can write these down in your notes. A lot of these have to do with our ring of roots. So when we talk about these different regions of the body, so the first part is this cephalic, so that head, frontal being the forehead, orbital being the eye, buccal being the cheek, mental being the chin, and then facial would be on the face. Here's a couple down here you can see in the posterior view as well. Is that occipital? So the back of the head is the occipital. Another part of that axil region is going to be the cervical or neck. So the front of the neck is cervical, and nusical is the back of the neck. And that torso or thoracic region is going to be the celiac, which is going to be the abdomen, mammary, which would be the breast, sternal, going to be the area in the center of the chest where the sternum is, pectoral is the area around the breast, costal is the ribs, integral is the groin, and then genital would be your reproductive organs. Now, last one, the coxal, is the hip. And then looking at the posterior view here, dorsum is going to be in the back, kind of relating to that dorsal. Vertebrae, area of the spine. Interscapular is going to be between both the shoulder blades, and then lumbar is going to be the lower back region. And then sacral is going to be between the hips here. Perineal is going to be the pubic arch area. Looking also in the upper limbs, when we look at that appendicular region, is going to be the acromion, so the point of the shoulders. Brachial is the arms. Antecubital is the front of the elbow. Cubital is going to be the elbow. Antebrachium is going to be the forearm. Palmar for the palms. Axial for the armpit, and then digital for the fingers. Lower limbs on the appendicular region. Gluteal for the buttocks. Femoral for the thigh. Popliteal for the back of the knee. Patellar for the knee. Curl for the leg. Plantar for the sole of the feet. And pedal for the foot. So next we're going to talk about body cavities. So you have a posterior cavity and anterior cavities. So you're going to have cranial cavities and vertebral cavities. On your anterior cavities, you're going to have thoracic cavities and abdomen pelvic cavities. Your diaphragm also falls into this anterior cavity, which is a muscle that's going to separate those two cavities. So you would see that in this area here. Looking at the posterior body cavities,